Hey, it's Dr. Gannaway. I help people get back to spending time with their kids, their grandkids, and just back to their lives by helping them conquer pain, disability, limited mobility, fatigue, and a number of other issues through minimally invasive procedures, regenerative medicine, manual therapy, herbs, nutrition, and lab work. Today I'm going to be talking about regenerative medicine preparation. So I fell off a cliff when I was in my early 20s, so quite a while ago, but I did shatter some bones and pop some things and pop my lungs and a number of other things, but I definitely had some personal experience with pain. Definitely was told that I would be in a severe amount of pain for the rest of my life and that things would not change by a number of practitioners that I think meant the best for me and were just trying to be truthful. But that did inspire me to get educated as I could and to obtain multiple medical degrees and go through multiple trainings to try to be able to bring to people what I ended up getting, some along the way of that. And as somebody that lives now with kind of minimal pain and a pretty good life, I want to make sure that other people can do the same. So today I'm really talking about preparation for regenerative procedures, but I'll be getting into diet and some specific supplements. This is only meant to be information. It's not meant to be your personal medical guidance. It might guide a conversation with your doctor because then they can tell you if these things are appropriate for you, but you need to meet one-on-one with somebody that's a medical provider to make sure if you're doing something with your body that it's safe. So I'd say if you're not like really at the point where you're going to be starting a regenerative procedure like prolotherapy or stem cell or platelet-rich plasma or extracorporeal wave, it's still a good idea to listen because you want to be ready. You want your body to be capable of healing, and you might just feel a whole lot better if you are able to take care of yourself under the guidance of a medical provider. So with this, I'll start with diet. So carbohydrates. They're a huge component of the American diet typically. Lots of sugar, lots of simple carbohydrates. It increases pain levels tremendously. A big part of my pain control in my life since my injuries was keeping my protein really high and keeping my carbs really low, because after falling off a cliff, I didn't get away with just eating whatever crud I did before. Not that I had a terrible diet, but it was not particularly good. So with sugars, you want to cut those out completely. With simple carbohydrates, most people should get rid of those from the diet. I know everybody's not going to be perfect all the time, but trying their best. And things like white rice are simple carbohydrates, whereas like brown rice still has its fiber sheath, still has nutrients. It's a complex carbohydrate. Quinoa's another complex carbohydrate. Quick oats is a simple carbohydrate, while steel cut oatmeal is a complex carbohydrate. Then when you look at protein, you want to, I'd say an individual typically would want to shoot for at very least half their body weight in grams of protein a day. And when I say that, I mean like if I'm 140 pounds, I'm trying to have at least 70 grams of protein a day. And often most people would do well with having at least their body weight in grams of protein a day. However, there are some conditions where like somebody has kidney failure where they have to be careful about protein intake, whereas most individuals don't have to worry. Then there's the concept of like vegetables. Okay, you typically would want a lot of green leafy vegetables. Occasionally people are on blood thinners and different things where the situation is a little bit more complicated, needs to be managed. Having different colors of vegetables is typically great for antioxidant profile. Then when we look at the nightshade family, a lot of people have an inflammatory response to the nightshade family, but not all people. So what do I mean by that? Tomatoes, bell peppers, potatoes, hot peppers, eggplant, but not everybody has this response. Then starchy vegetables, that is a thing where they're pretty similar to simple carbohydrates, and generally somebody really doesn't want a lot of those. Though there's particular cases where somebody might want to throw in like one serving of particular ones for other reasons I won't get into. But kids, they'll typically need maybe a little bit more than the typically recommended one serving of a complex carbohydrate a day. Then we get into, fruit and dairy, because you think of sugary. And people don't tend to think of dairy as sugary, but in reality, it breaks down to a lot of sugar, a lot of inflammation. So if somebody's going to still have one serving, it's like looking at, milk being super inflammatory, that liquidy, and then all the way down to the aged Parmesan cheese, which is typically going to have the least detrimental effect on somebody as far as inflammation goes. And then with fruit, bananas, people say they're having them for potassium, but an avocado is typically a great substitute for that, and there's other sources of potassium. But berries are a really great source of antioxidants, so having like the one serving a day berries can be great, but at the same time they are heavily sprayed, so making that decision, are you going to have something that's heavily sprayed, or you're going to go ahead and get organic berries, so you make sure you're not giving your body more of a toxic load. And these toxins, some of them can build up in your fat cells. And then there's regenerative medicine. They're staying away from like artificial sweeteners and certain things that are going to build up in the fat cells, especially if somebody, depending on the region or what country you live in, some people are able to get stem cells from their own fat cells, and that could be really useful to them. And so we want to keep them very clean. But you want to keep your body clean anyway. And then looking at fats, there are certain fats we need for structure, like the omega-3 fatty acids, which are really important for our cell membranes being nice and fluid, so everything can move and function properly, and our cells can respond properly and live and die when they should. Make sure our skin is got a lot of resources, so it's not all dry, but also, all the other tissues in our body, make sure our brain functions well, make sure our joints are well lubricated, is really important. So for a vegan or anybody, typically we think of chia seeds as being kind of the master source of omega-3s without giving too much of the inflammatory fats with them, and being able to dose high, which can be great for a lot of people with pain issues, joint pain, and that kind of thing. Though there are certain cases where somebody needs to limit that due to blood thinners. But then also, if somebody's having a procedure, maybe if they're just having extracorporeal wave or they're having an injection therapy, they don't have to be as conscious of this. But if you're having a procedure where you're getting a cut and there's a doctor having to think about how much of things they're having to give to suppress too much blood coming out, then somebody's going to want to limit that omega-3 and as well as vitamin C, vitamin E, and things in the blood for like a week before and maybe a week or two after. But for a lot of regenerative procedures, that doesn't really need to be limited so much, but you would want to talk to your individual doctor to find out. And then as far as looking at like the other fats, so you've got like the omega-3s really high in some fish and chia seeds, and there's other plant sources. I believe if you go to my link in my Instagram profile at dr.emily Gannaway, Gannaway, and if you request the depression freebie or gift, that'll give you like a breakdown of which fish has more omega-3s, because it's not like they don't have other fats in them, and some of the plant sources as well. And then we get into the inflammatory fat. So poultry has a good amount of inflammatory fat. So if you're like, well, I really get my protein from chicken or turkey, having it be skinless, and if there are chunks of fat, taking that out. because generally we just need a teensy tiny bit of inflammatory fats, like for when you have a fever or like you get a big wound all of a sudden and you need a certain amount of inflammation to be going on. And in these regenerative procedures, we're having like very targeted inflammation. So it's not a ton of inflammation, it's just inflammation exactly where we want it. And so with like beef, the other red meats and pork, they have a lot more of inflammatory fats. So it's like having them be real lean can be really helpful. And then you look at the plant fats, and we're looking at like, canola oil, corn oil, cottonseed oil, being pretty inflammatory. Peanut oil, so like canola oil isn't a lot of organic, like salad dressings and things, but it's derived from a plant that's related to rapeseed and is pretty inflammatory. Like I notably can tell the difference in pain levels of having it, but it's kind of like sneak in there because somebody won't know why they had like a flaring of their pain after having a salad with organic salad dressing because they thought they did everything right. But then there's different fats that are really healthy to have. Not that different kinds of fats are needed. We need slight bits of inflammatory fats, but typically people are already getting these things. But then looking at like almond oil is healthy. Olive oil is healthy for you. Once you cook with it, it changes structure, so it's not so healthy. So cold pressed olive oil, like in your salad dressing or on your dish after you've cooked it, great. Coconut oil and avocado oil are really great for cooking because they are very temperature stable and they're good healthy fats. Once again, healthy, not felt healthy. We need a little bit of these other things, but it's like a smidgen compared to the other structural fats. Then like nuts and seeds for most people are pretty good. There are different things that vary with like Hashimoto's thyroiditis and all these different things. So I'm not getting into that there, but this is a pretty good basic diet because even with autoimmune disease, keeping the carbs low can have a significant impact on how that autoimmune disease plays out symptom-wise and the person's future. And so we've talked about like this general diet. And then it's like, having enough protein to support nice level blood sugar by having at least half your body weight in grams of protein. So, 140 pound person. Starting out, I shoot for like at least 70 grams of protein, but in general, I get well over my body weight in grams of protein, and some people do have to limit that if they're in like kidney failure. Then we look at other things like particular supplements, or in some cases, people can be really on top of their diet and they can find ways to get these sources other ways, and I will talk about that a little bit. But in some cases, things have gotten a little out of hand, and sometimes supplementation is important. So vitamin C is really important. I talked about it as like it can be a little blood thinning. So somebody's having a procedure like you're getting cut open, like a surgery, avoiding it the week before, week or two after can be an important thing. But prepping, before that to make sure that you're not needing to see bruiser can be pretty important because vitamin C helps with cell membrane stability. This is why when people are low in vitamin C, they often bruise pretty easily. Like they might not even know where the bruise came from, or they hit something, but like not really hard. Or like hemorrhoid bleeding can happen. Usually there had to be something that also caused a little extra pressure down there, like having a baby or just pushing and that kind of thing. But that's pretty important to have that at good levels. And then collagen is pretty important. So I know like I have a number of vegan patients. It's like making sure getting collagen is still pretty important because it is, if you look at your tissues with a microscope, you'd see so much collagen, like your blood vessels, your joints, your skin layers. It's all over the place and you really need it. So as far as the vegan, I'm looking into that more. I know it can be extracted from fungi and bacteria. which is usually not something people are avoiding as a vegan necessarily, though everybody's got different rules of diet for religious purposes or whatever they're doing. But then, if somebody does consume meat, or if they don't really mind having like bone broth, because most of the bones aren't necessarily all used up for the amount of meat or cows that are used for people to eat, then bone broth can be an option. There's a lot of different supplements that can kind of pack in as well, but I'm not going to get into particular supplements here. And like with the vitamin C, like I said, like if you want to be easy bruising, then it's like making sure vitamin C is getting absorbed. It's like some things like citrus has some vitamin C, but then if somebody's really a phlegm performer, since it's a catarrh, it'll cause people to get more congested. So yeah, sometimes it's good to see a doctor to figure it all out more specifically. And of course, don't start any of this stuff without consulting your practitioner and making sure they think it's a good idea for you in particular. So yeah, we talked about omega-3s. So it's like chia seeds have like 2,400 milligrams of alpha lipoic acid, which typically gets converted into the other omega-3 fatty acids. So some differences in genetics can change how much it converts. And then there's different fish that will have omega-3 fatty acids, and some other plant sources that have omega-3s, but chia seeds are kind of known for a huge portion, and then also compared to the other fats in it. And they're mostly like fat, omega-3s, fiber, and protein, so that's kind of nice thing to add into the diet. So general recommendations would be like 3,000 milligrams, and then sometimes people take more for other reasons, and talk about like why you need to talk to a doctor for sure, because sometimes people do need to limit it a little bit right before and right after, but as a preparation, like I'm going to go in for these procedures and this much time. It can be great in some less invasive procedures. It can be great just to be doing the whole time through, because you need that, for your brain, for your joints, for your skin, for everything. And then there's B vitamins. So B vitamins are so important for metabolism and energy production and remodeling. With vitamin C, we talked about briefly, you need vitamin C to absorb iron. And so this will go into our talk when I talk a little bit about the importance of labs. But then you need iron to make a healthy red blood cell that can really bring your oxygen around in your body. You also need B12 and you need folate. So you need iron, B12, and folate all together to make this healthy red blood cell that can circulate throughout your whole body. But we'll talk in more detail about that in a minute. But, B vitamins, you need those. They're pretty water soluble, so generally pretty safe. A lot of people have methylation errors with their B12 and their folate, where one or more of the enzymes that they make genetically for either of those vitamins or both cannot attach to the methyl group. So, too complicated biochemistry, but in those cells where that's happening, that biochemical process is not occurring. And so that can slow people down. So often people will feel a lot better with the methylated B complex. Then, there's water. So getting half your body weight in ounces of water. In general, if somebody's not like, dehydrated in the heat of really hot summer or, working out a lot, we'll typically meet somebody's general requirements from day to day. However, somebody should always talk to their doctor about this, because some people do have more severe kidney issues or issues with where they'll swell up and they need specific guidance around that. And then with regenerative medicine procedures, if it's healthy for somebody and they're a good candidate, they might need to drink significantly more water the day before, especially if they're doing something like platelet-rich plasma or PRP, because there's an amount of blood that's taken. And so you need to have all that fluid in the system besides the extra fluid you need for your body to deal with the procedure, and then having that water afterwards in higher amounts to help make sure everything's flushing and working right. But that's another situation where somebody really needs to talk to their doctor. With the regenerative medicine therapies, somebody needs to avoid NSAIDs, so non-steroidal anti-inflammatory drugs. So that's like your ibuprofen, your aspirin, a lot of these over-the-counter pain medications. It's also a good thing to note that they do start to eat away at the digestive tract lining, so they can be really dangerous for somebody that has gastritis, or if it's gotten all the way to ulcers, because they could perforate their, or like open up their gastrointestinal tract to the rest of the body. But in general, just like you're getting regenerative therapy, you want to make sure you don't have those non-steroidal anti-inflammatory drugs, because then they're going to stop this very targeted inflammation that's supposed to happen to help remodel the tissues. If somebody can avoid it for 3 months before, that's fantastic. And if they can avoid it, throughout the whole treatment protocol and afterwards for a while, that's great. But at very least, not taking anywhere near the procedures is very important. And then we get into iron. So when you look at that, there's a lot of people that have too little iron, but there are cases where somebody can have too much iron. This is more common in men because they don't menstruate, and they're more likely to have certain diseases or conditions where they might even need to give blood because they have too many red blood cells. But that's not the case for all. Like, there's still a good number of men that will tend towards low iron. Just like I was talking about gastritis, that can be a cause where they didn't notice any blood when they had bowel movements. Maybe their stools were darker, maybe they weren't, but they're just losing a little bit of blood, and then blood's not getting everywhere it needs to go. Because you want your under eyes to be nice and red, not like white with some red capillaries on top. And the fingernails need to be decently red, and so a lot of people I'll see, when I'm starting to see them, it's like they have white fingernails, or the middle portion is white, like this middle third, and it's like, ooh, we got to make sure blood's getting everywhere. But that could just be from B12 and folate issues, but it could be from iron as well. And so it's like testing, it can be really important. So there's serum iron, which basically says how much iron is in the bloodstream at that moment. And then there's, so that could be like somebody took an iron capsule, like just over the counter, little tiny dose, or they ate from a cast iron pan, it doesn't necessarily reflect anything about how much iron's been in their system for a long period of time. But then there's ferritin, which reflects the iron stores. However, it can't, so if it's quite low, we're like, oh, we got to get those iron stores up. But it can be high just from inflammation, so it's like testing other inflammatory markers can be important to be able to tell that. But then, it's like with regenerative procedures, it's generally trying to get that person up to like 120, not like riding on the low side of things, because to make sure blood's getting all the way up here, all the way to the joints, because the joints don't have the best of blood flow, especially if somebody has joint pain, like when they've got osteoarthritis and the structure is compromised. And then there's thyroid. So there's certain periods of life where, especially women, are at increased risk of thyroid disorders. So there's like the postpartum period, and there's perimenopause and menopause. Women are a little bit more susceptible to developing autoimmune diseases because we tend to have an immune system that's like working harder. That can be good in some cases because we're generally maybe less likely to die of a bacterial infection. Overall, some women's immune systems are kind of not working so well, but also more likely to get autoimmune disease where the immune system is so vigorously attacking itself, or attacking the person's own body. And so that's often the cause of thyroid disorders. But so getting somebody to get a full thyroid panel is pretty important. So TSH coming from the brain going to the thyroid is often all that's tested. That's not actually thyroid hormone. That can be good information to have, but it won't necessarily tell us what's going on. Testing what's free T4, total T4, free T3, total T3 will tell us about the actual hormones coming out of here, and how much is coming out at that moment. And then testing, thyroid peroxidase antibodies, thyroglobulin, and sometimes some other antibodies, depending, will tell us, like, if the antibodies are high, we know that we don't know for sure how that thyroid's functioning, because when an antibody attaches to a cell on the thyroid, it'll make it burst and it'll increase the thyroid levels. But at the same time, that cell's going to scar down and it's not going to be given thyroid hormone again. So it's important to have that full thyroid picture, because a lot of people having their hypothyroidism managed with thyroid hormone can be really important. Some people are on like Cytomel or levothyroxine, which I'm not saying doesn't work for some people, but makes it a little harder to test because those aren't actually going to show up as thyroid hormone because they're a different molecule, and some people do respond a lot better to Armour or Nutrifluid. That depends person to person. Of course, consult your doctor. Then there's testing vitamin D. So vitamin D is really important for the body. And making sure it's at a good level so you can get through and heal well. So when we look at the US population, if you're looking at like even hitting like very minimum vitamin D levels to just like kind of say like you're not in a super scary level, over 40% of the US population is not getting there. And when you look at what's optimal, it's like most people aren't getting there. It is a fat-soluble vitamin, so you don't want to go way overboard, but it's a good idea to get it checked because you do want to be in an optimal range because you want good bone density, you want all these things to function well. And then people will often be thinking that they need to be taking more calcium, and that's what's going to solve the problem. While like in the postpartum period where a woman's breastfeeding, there needs to be a lot of calcium out in the bloodstream to go in the breast milk so it's not leached out of the bone. That can be really important in pregnancy to a certain degree. And sometimes in growth and things like that. Often in adulthood, people are supplementing a lot of calcium, and it's not actually like going in their bones to make their bone structure better. They're kind of getting it places they don't need it, like on tendons where they run through the joints and different areas that are like causing pain and dysfunction and might be the cause of their joint pain. Though obviously there's other factors that go into that. It's like, but with these regenerative therapies, it's like trying to get things to work right again. It's like, there's osteophytes and things like that, dealing with that. But then there's hormone regulation. So that's pretty important as far as regenerative capacity. And all these things, obviously, I'm talking about, like getting it in line can make a huge difference in somebody's life without even getting regenerative, procedures per se. But, if something, it's like you have a particular joint that's messed up, it can be pretty important. Or if there's a lot of calcifications around your joints in different areas, it's pretty important to make sure you're staying healthy. But with hormone regulation, when you look at a male, testosterone can make a big difference in their lives, and DHEA as well. And so men will often start to decline in their level of testosterone. And there's concerns as far as the prostate, but, with testosterone, because you want to make sure you're clearing things. You always want to make sure you're clearing things. And that's where diet becomes really super important. And try to make sure you're a male, you don't end up with a huge prostate. I mean, I can't tell you, I've seen some huge prostates, like in cadaver labs and medical exams too. It's like, I can get out of whack and really mess with them and its experience of life, obviously. And so making sure diet's good, but then also getting testosterone levels checked. So seeing sometimes when people are younger, they basically need to get the things in their brain and different areas and certain nutrients up to get things working again for them so they can have that vitality. Because testosterone, having enough testosterone can help with glucose regulation and lipid regulation and just like, obviously the composition of your body then. And then when people are older, sometimes they will take like bioidentical hormone replacement of testosterone to make sure they're staying healthy. And because, with joint pain, you need to make sure you have good muscle around that joint so it can stay stable. And then with women, sometimes when we're younger, we get so stressed that systems kind of shut down and we're not making enough estrogen or progesterone. Sometimes people aren't getting enough healthy fats like cholesterol to make them. Sometimes they're not having enough protein, and it impacts the system, where there's just so much stress in life. But making sure everything's functioning well, that's where it's like, naturopath might be a great idea, because I'm a naturopath as well as I have other medical degrees, but there's a lot of training around interpretation of labs and how to deal with that. And so then there's also, once a woman gets to perimenopause and menopause, it's like sometimes depending on certain things with their lab values, it's still good to be targeting, getting the brain to get the body to make those hormones. But sometimes some hormone replacement therapy or other things to help keep the body healthy is important, because when you think of like estrogen going down, it's like, I pinch my forearm, it's like this, but if I pinch it in a woman in menopause and her estrogen's been shot for quite a while, it'll be like I have a piece of, it'll be like pinching a piece of paper, like literally often. And then with progesterone, it's like, we think of, estrogen brings the blood in the uterus and progesterone helps hold it in there. But then, it's also important for water metabolism throughout the body. And so women will start getting foggy thinking, and their tissues will just start to get deemed just like more puffy body. And so things won't necessarily work quite right. So getting that checked out by a doctor. Another thing that I often have people do sometimes is preparation, which can be really great if they're willing to do this, is alternating hot and cold hydrotherapy. Afterwards, though, that varies very much from which regenerative procedure they're having. Like if it's an injection or there's some kind of cut open in the skin, then alternating hot and cold right afterwards, within the first week or two, is very inappropriate, because you don't want to be soaking the body part in water. But that does require water. Like, so somebody might do that before, like 2 minutes in warm water, 30 seconds right afterwards in cold water. Let's say it's like you got your finger joints. You soak your finger in warm water for 2 minutes and cold water for 30 seconds. 2 minutes warm water, 30 seconds cold water, 2 minutes warm water, 30 seconds cold water. So at least 3 cycles of that. I was starting with the warm and ending in the cold, and that time ratio, like 2 minutes and 30 seconds, is very important. It's actually been studied as far as like macrophages coming into the area, and so helping to the immune system to move throughout there and get things flushed and working well. And then with like extracorporeal wave, I'll often have people do that, especially if it's like finger joints afterwards, as long as the skin's not irritated at all, just help flush. So if we've broken up calcifications, it just doesn't resettle in the area. But then, with injection therapies, or if there's any kind of cut open, really don't want to do that afterwards, because somebody's not supposed to, take a bath or go swimming for at least a week afterwards. It's like, you obviously want to keep the area clean, so it's like showering, but you want the water to come right off. It's like that's where if there's procedures on the foot, it's really important. It's like clean your socks. You're changing your socks like 3 times a day for the next week, and being really on top of it, because a joint infection is no joke, and never ever want anybody to get that. So that's a lot about just prepping for regenerative therapy. There's general things like bowel frequency would optimally be at 2 to 3 bowel movements a day, because you want to make sure that your body is able to move things at an efficient rate to get nutrients out of what you're eating, but then also so toxins that are dumped into the gastrointestinal tract get out to the other side, instead of being sucked up by your hepatic portal system and then just thrown back into the body. And for women, it's like, they can end up with this picture where trash estrogen, so it's like it's been made into a form that's supposed to be dumped to the gastrointestinal tract and go out of your body, is getting recirculated. That can cause all kinds of problems, like little hairs popping up places you don't want it, and like weight gain, and all kinds of things. So that is pretty important. So it's like sometimes, it's talk to your doctor, but sometimes it's appropriate for somebody to have magnesium because that's sometimes the cause of why their bowels aren't moving well, because there's two layers of muscle around the gastrointestinal tubing, and magnesium is the major nutrient for the muscles to relax, so it's like helps it keep moving. And then calcium can be constipating, but is the nutrient for the for the muscles to contract. And so that there can be some fine tuning with that, and dosing can really vary quite a lot. But if somebody's low in magnesium, they might get tension headaches or tight neck or shoulders or muscle cramps in different places or calf cramps. But that can really vary, and so it's always important to see a doctor. But just wanted to give you a general idea of how to prep for regenerative therapies, and hope this is helpful for you and helps guide your conversation with your doctor. But always seek one-on-one care. I do encourage you to, one, I have like a summary sheet you can get on what we talked about here that will be more concise than you have to listen to a 40-minute presentation again. If you go to my Facebook or my Instagram, is really easy to go to at dr.emilygannaway. So it's at dr.emilygannaway, Gannaway. On the link at that profile, I have where you can get the summary sheet. And then for the June 13th event, I'll actually be getting into these different regenerative therapies. It's like, oh, there's stem cell, and everybody hears about that, and that's something. But then there's also prolotherapy, and there's platelet plasma, so PRP, there's extracorporeal wave, there's hyperbaric oxygen. And so what somebody needs can really vary. So sometimes one procedure might be great for one person, but it might cause a flare in pain and be inappropriate for another person. So that's on June 13th, 5:30 to 7:30 p.m. at TriOasis in Portland, Oregon. You can call 971-205-5593 to reserve your seat. There's only 25 seats total, so I don't know how many of them have been taken already, but there is an $8 reservation fee just to make sure that people are coming and are really interested. But then people can use it towards like the purchase of a product there. I think they sell different CBD and things like that, and they have some pretty awesome therapies there. But we'll get all into that information then. So that number is 971-205-5593, and then if you want to make an appointment with me over at Medipro Holistic Health, we can get into all that kind of stuff I talked about today, or if you're already prepped and ready, just getting a basic intake and then follow up, get into the regenerative therapies if appropriate. And that number is 971-828-9265. Oh, sorry, 503-828-9265. Medipro Holistic Health. But I hope this helps you, and have a great day. Bye.